whenever there's a GI bleed, that's correct. And they also
What you see here are future nurses at work. At Augusta State University, they're gaining the skills it takes to become some of the best registered nurses in the country.
And I enjoy helping people and making them feel better and doing what I can to get them back on their feet.
Today, they're learning tricks of the trade on how to insert a nasal gastric tube.
I found that if you refrigerate the tubes, they slide down better. Okay.
Right now, there is a global shortage of nurses, and that need is not expected to go away for the next decade. Locally, statistics show
by 2010, they're expecting a shortage of 20,000 nurses. So we knew in our community that we had to work to grow the numbers of nurses who could be graduating. We also know that in the state, there were over 4,000 nurses who were turned away from nursing schools last year because there was not adequate faculty.
To overcome this, Marilyn Bocut, Vice President for Patient Care Services at University Hospital, helped develop a partnership with ASU to bring more students through their nursing program. In order to do this, 2 assistant professors were hired. Over the next 2 years, University will give $336,000 to ASU to pay the professors' salaries. Dr. Charlotte Price says she has already seen a difference in her program.
This summer is the first time that my basic students were able to continue their education. As a result, they will finish a year earlier. It has provided opportunities for students that we couldn't take simply because we didn't have the faculty to do that. So with the additional faculty, we've been able to increase our admissions. And as I mentioned, for the first time, I believe we are very close to graduating 100 students, and that is a major milestone for us. Could not have done this without University Hospital's support.
What do you do?
Oh, you would check the paint and see.
Nursing will be a second career for 49-year-old Sandra Quinones. She says she's grateful for the new faculty at ASU. Without the new assistant professors, she, along with her 31 other classmates, could not have taken this summer course.
I really appreciate that university is so forward-thinking that they are able to grant these kinds of bequests to the school. And I really appreciate that because more of us who really want to be in nursing can come into nursing, and we can get the quality of teachers that we really need so that we can make a difference in our community.
New assistant professor Fran Sloan is proud to be part of the solution.
It is an exciting profession and being able to impact on the healthcare. So even though I'm not practicing, I'm giving all my knowledge and expertise to the students so that they could provide the nursing care in the future.
Over at Augusta Technical College, there's exciting news. A 2-year nursing program is now in place. Marilyn, along with Terry Elam, put in a lot of time and energy to get the approval needed to begin the program.
And a classic example of a great partnership, though, is with the cardiovascular program, where University Hospital actually pays for the instructors. They provide the classroom space. They provide the laboratory space. I'm excited about the nursing program. I'm excited about what University Hospital is doing for Augusta. We're just a small part of something much bigger. Everything is accessible. University is a flagship and in a leadership role for healthcare in this community.
Educating tomorrow's caregivers continues on the campus of University Hospital. University trains the region's leading graduates in the fields of radiography, dietetics, and cardiovascular technology. Last year, University allocated nearly $800,000 in funding to meet the ongoing needs of these programs.
Now, who can tell me if this is a good or bad film and why?
The Stephen Brown School of Radiography has a reputation for high standards, and their students are typically placed in a job before they graduate. In 23 months, students get work experience as a radiographer and spend 2,000 clinic hours per year functioning as a technologist. Nancy Elliott says the experience gained here is second to none.
When the students come out of our program, they are prepared to go to work. There's no having to retrain or show them how to do things. They're exposed to so much here, and that's a really great advantage, I think, because they could pretty much go anywhere and walk in the door and be ready to work.
Students also develop an attitude of professional behavior, responsibility, and a love of learning. Looks delicious. Excellent service is the goal for Jeannie Lee, Program Director for the Augusta Area Dietetic Internship.
Every patient has to have a diet order, and diets are specific to the type of medical condition. And the diet is just as important as the drugs or the tests that they're going through.
The past 27 years, nearly 400 students have become registered dietitians through university's program. After 44 weeks of supervised practice in clinical, community, and food service management rotations at university, they are workforce ready. The pulse of this program is diagnosing vascular disease. Students are taught in-depth knowledge of vascular anatomy, disease, and treatment.
Very good. And what do you have for the
After the first year of classes, students select one of 3 specialties offered at the Harry T. Harper School of Cardiac and Vascular Technology. Pat Thomas describes what students are doing today in the Vascular Technology program.
Looking at the carotids, which are the arteries in the neck, the students are able to visualize if a patient, if there's some sort of plaque.
Because it's sterile, so I need you to touch it with your gloves.
This is one of the proper techniques used to keep a sterile environment, which is vital while working with heart patients. They don't miss a beat in non-invasive technology, the third specialty offered. With the use of high-energy sound waves, the technologist can perform 2-dimensional real-time imaging of the heart.
Well, you're doing nicely, though. You're getting a good image of the aorta and the aortic valve.
Students visualize blood flow through the chambers of the heart. This helps diagnose and treat patients with cardiovascular disease.
Go ahead and make your aortic root measurement.
Professors monitor performance as students strive to achieve the high standards that are set for quality patient care.
When I think back over the last few years, we're actually seeing today many great outcomes related to the efforts and the support the university has given. At university, we have helped each of the different schools of nursing.
University's foresight and significant financial support have made all these programs a reality. Investing in healthcare education will not only strengthen university's position as a state-of-the-art healthcare leader, but also will help provide beneficial support to the community in which we live for years to come.